Hello everyone, how's it going? Well, how well do you sleep? According to the CDC, most adults actually need at least 7 hours of sleep a night, and that includes older adults. However, it's possible that up to 75% of older adults are experiencing symptoms of insomnia. Well, what unique challenges do they face, and what can be done about it? If that sounds interesting to you, then keep watching. Now, having insomnia for just one night can really make us feel miserable the next day. There are about 10% of adults who actually are experiencing chronic insomnia. So that means they have trouble sleeping 3 or more times per week, and it's been going on for at least 3 months. And that's something that can really cause some serious health conditions, or it can make the ones that we have already actually be even worse. Now, unfortunately, as we get older, we may have more pain, more serious medical conditions. We take more medications. We may be more susceptible to psychiatric conditions or disorders. We may have other sleep disorders, and we may even have mobility issues. The good news is, though, that we can make some small changes that can really make a difference. First of all, obviously, as we get older, we have more disruptions and changes to our circadian rhythm. But what we can do is try to keep on a good schedule as best we can of getting up about the same time every day and going to bed at the same time every night. We can try to avoid taking long naps or naps that are too late in the day. We can also try to spend more time outside. I know I've been trying to do this a little bit more. It seems like we're inside so much. But if we can be outside enjoying that natural light, it can really help us a lot. If that's not possible, we might actually be able to try out some light therapy. Another thing we can do is try to get at least some physical activity each day, whatever your doctor says is safe for you. Of course, you wouldn't want to do any very intense exercise late in the day, too late in the day, because that could disrupt your sleep as well. Now, in addition to those changes, we may need to talk to our healthcare team about our medications. I know some people have to take diuretics, like water pills, that makes them have to go to the bathroom frequently. There are certain blood pressure medications and other medications that can cause daytime sleepiness. People have to take steroids or thyroid hormone, and some of those can actually keep us awake at night. So if you could just take a few minutes to speak with your healthcare team, perhaps even your pharmacist, to try to organize the best time of day to take each of those medications, it could help with your sleep schedule. Of course, sometimes I know it gets more complicated if you have to take things twice a day or more, but just do your best to try to speak with them about the best way to organize that so it doesn't disrupt your sleep. Now, before we move on, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, I'd like to remind you to always open up the description box. There's some links below where you can actually read a little bit more information on this topic. I also appreciate your feedback, so if you'd like to leave some comments, I welcome those, and I know many people enjoy reading your comments. So if you've had to experience insomnia and you've found something that works for you, I know people really enjoy reading those. Now, you probably heard about caffeine and nicotine and the negative effect it can have on sleep, but sometimes people don't think about alcohol. It has sedative properties, so it can make a person fall asleep easier, but the problem is that you tend to sleep much lighter, so it's much easier to be awakened, so it's more likely that you're going to have sleep disruptions. Now, super important to speak with your healthcare team if you are having sleep issues, because we may have a breathing disorder, such as sleep apnea. It's possible to have restless leg syndrome. Studies actually show the prevalence rate almost doubles with age. Some people actually have an REM sleep disorder, which is where they actually physically are acting out their dreams. So getting these conditions treated can make a huge difference in your quality of sleep. Now, if you're still struggling with sleep, many people have had success with CBTI, which is cognitive behavioral therapy for insomnia. And this can be very convenient to get this therapy because it is available in person and online. Now, healthcare professionals actually find this to be a better option, especially when it comes to older patients, because when they prescribe sleep medications to them, they are actually possibly going to be more at risk of falling, having drug interactions, or becoming dependent on the sleep medications. Now, as we get older, it may take longer to fall asleep. We do produce less melatonin. We may spend more time in those lighter sleep stages, so it's more likely that we're going to wake up in the middle of the night. But it's nice to know that we can make a few lifestyle changes that can really help if we're making sure we get appropriate treatment for sleep disorders, and we take our medicine at the best time of day possible. These all can really help us with our sleep quality, and making sure we're treating this as a serious issue, it can really slow and reverse some consequences that could be pretty bad on our health and our well-being. And so we definitely want to do the best we can to work with our healthcare team to make sure that we are not dealing with chronic insomnia. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.